Now we're going to think about age-related hearing loss. Have you ever been accused of mumbling by an older relative who complains that young people now do not speak clearly? Or perhaps a grandparent has commented they hear better with their glasses on. Age-related hearing loss is the most common sensory impairment associated with ageing, something that we are all likely to experience. Hearing loss at any age can have a devastating effect on an individual. In older adults, hearing loss can limit social contacts, restrict work opportunities. Individuals cannot hear anyone behind them, giving them a sense of insecurity. They may find it impossible to communicate in the dark or poor lighting conditions, and will find access to group discussions are limited, with frequent misunderstandings. Hearing loss can be an important factor in contributing to isolation, depression, and has been linked with dementia in the elderly. Unlike deaf children, adults who develop age-related hearing loss have intact language but are faced with not overhearing, misinterpretation of comments, inability to use the phone or communicate with family with ease. Age-related hearing loss may also include tinnitus, ringing or buzzing in the ears, and vertigo, dizziness. This can be very disabling even where support services such as audiology are available. In many low-middle income countries, such services are not readily accessible and individuals have to rely on family members for support. In such situations where age-related hearing loss is not recognised, changes in behaviour may be associated with intellectual decline rather than sensory loss, further isolating the individual. It is known that genetic, environmental and lifestyle factors act together in age-related hearing loss. Many factors such as smoking, alcohol abuse, diet, occupational exposure to noise, lack of physical activity, frequent infections, trauma, ototoxic medications all contribute to the etiology of age-related hearing loss. Lack of understanding of the factor means that for many the effects of age-related hearing loss are made worse. It is recognised that hearing deteriorates with age as part of the natural ageing process. In respect of the preventable aspects of acquired sensorineural hearing loss, in addition to the above factors in adults, the following factors have been identified as important. Chronic otitis media or middle ear disease, noise, barotrauma, blast injury, syphilis and infections. A fascinating study of age-related hearing loss of rural communities of 5 countries located along the Silk Road, Georgia, Azerbaijan, Uzbekistan, Kazakhstan and Tajikistan, identified that overall hearing loss was detected between 9 to 18% of the population. It was suggested that early onset of high-frequency hearing loss in males may be related to occupation, most particularly noise and the use of guns. Noise is recognised as the most prevalent and preventable occupational disease in many Asian countries. In a follow-up study of the same cohort considered the potential effect of the level of education on age-related hearing loss. The study clearly identified the relationship between educational level and age-related hearing loss. Low educational levels were associated with age-related hearing loss, whilst high education levels appear to have a protective element against this. There was a high correlation between education and occupation, with low levels of education being associated with noise-exposed jobs in the manufacture of fabric, construction or transport industries. Low socioeconomic class is linked to higher incidence of deafness. This may be a result of poorer hygiene, low immunisation rates and misuse of ototoxic drugs. Age-related hearing loss is a critical issue as the percentage of older people increases. It is estimated that by 2025, the proportion of the population over age of 65 will be 17%, with age-related hearing loss affecting a projected 540 million senior citizens. Age-related hearing loss has a negative effect on mental health, social well-being, the ability to understand speech, especially in a noisy situation or where there are multiple speakers, and is thought to negatively impact upon brain function. This is something that will affect all of us, either because we develop age-related hearing loss or a member of our family will. Taking time, repeating and rephrasing, making sure we have clear communication strategies and understand the challenges, rather than losing patience, will support those affected. To really understand the challenge faced, you're going to hear a simulation of a high-frequency hearing loss, similar to the type associated with age-related hearing loss. Do not try to adjust anything, just listen and imagine all your conversations sounded like this.
The most useful way is use the hearing screen and diagnostic test for hearing function, and it can provide good estimation of hearing sensitivity. Wave 5 is used as it's most robust and can be observed at sound stimulus level post auditory threshold. So the aim of this lecture is to provide more detailed information on the early auditory lobe potential, particularly auditory brainstem response. Intended learning applications